Mako system case plan. In order to achieve this, the patient's undergone a CT scan and we've taken that CT information, poured it into our Mako system to create what we see here in front of us, a three-dimensional model of the pelvis. Now, using this software, very easily get to something that's a little bit more recognizable to us, an X-ray mode view. This is essentially what your AP pelvis would look like. This is a simulated view based on that CT scan information. Now, we have already planned the hip replacement, and in order to look at that, I always like to start at looking at my final results. You can see that we're starting here 1 millimeter longer than the opposite hip and with equal offset to the opposite hip. And then we can look at our plan. This plan was performed by your local MPS, but can be modified by the surgeon. Look at our plan to see where we're starting from. And again, in that X-ray mode, we're able to take a good look at what our post-operative X-ray will look like once we execute the plan that's within the system currently. You can see currently we're planning for no change in length, so we'll remain 1 millimeter longer. And in this patient with a lot of offset, a very varus neck, looking at pretty low neck cut with an eccentric liner and a 127 neck angle with 7.5 millimeter head ball. Again, all these adjustments can be made by the surgeon if you would plan this differently. But I certainly want to confirm my plan. So we're going to look at the cup itself. We're going to look and see exactly in the CT scan views and angles how the cup fits and reams within the bone. So this is called the reaming view screen. The green is the bone that we take away with our reamer. You'll notice, and somewhat you may or may not be comfortable with it, initially we don't always remove bone from the deepest of the cotyloid, but here we can see on the CT scan in transverse, sagittal, and coronal planes that we're making good contact with the cup and the bone. This is just me scrolling up and down here in the transverse plane to demonstrate good purchase of the cup within the bone. This is the sagittal plane, of course. Now perhaps I would choose to decrease the cup size or even move or shift the cup, which could be easily done here with these arrows here. Here's the coronal plane, again, something a little bit more traditional and what we're used to seeing. So in 3 dimensions, we're planing the cup to make sure there's good cup contact with the native host bone. And I'm actually real pleased with this cup planing here. We can look at our femoral plan as well. You'll notice that the system tells us there's 16 degrees of anteversion. This is based on the CT scan, taken off measurements, certain measurements on that CT scan. We want to use that as a reference, and we'll confirm that after our neck cut to see what clinically we think our femoral neck version is. We certainly want to note that with regard to how much abduction and anteversion we want to put on our cup. Looking here at this view, again, the CT scan overlay, you can see the stem in place. We size it to a size 6. You can very easily change it to a size 5, and in hard bone, this could get good rotational and longitudinal fit with a size 5, but we're going to start with our plan of a 6, which I think is good here. I mentioned earlier, this is a very low neck cut given the varus neck of this patient. You can scroll through these images and see exactly how low on that lesser trochanter it is. The orange dot here represents the center of the lesser trochanter is a good reference mark. I'll just mention a couple other things here about our system. When you see pink here, this is the edge of the bone. That's seen in all windows. We saw that back side as well. The other thing I would mention is we're demonstrating today the Express workflow. The Express workflow utilizes a single pelvic array that we get accurate cut as well as length and offset. There is an enhanced workflow in which we place an additional array at the femur itself, and we're able to get intraoperative femoral version during our broaching process. So there's certainly other options and expandability with the system. Also, the enhanced allows you to actually navigate your neck cut. So those are all options within the enhanced workflow. But we're going to be demonstrating Express today. And before I step away from the monitor, this can be done prior to the case or even days prior to the case if you'd like. just to make sure you have confidence in your plan, I always end on this exact same image, which again is the created information from the CT scan to make it look like an X-ray. This is our goal for our post-operative X-ray, and I'm actually quite pleased with our plan.